Hemorrhoids from A to Z, causes, symptoms, and effective treatments. Hello, everyone. Today, we will discuss a common problem that many of us face: hemorrhoids. We will help you understand the causes and symptoms of hemorrhoids, and especially help you realize that modern hemorrhoid treatment is not as horrible as imagined. What are hemorrhoids? Hemorrhoids are not just simply a disease of the veins. They involve a complex system of blood vessels ranging from arterioles, venules, arteriovenous communications to smooth muscle and connective tissue lined by the normal epithelial layer of the anal canal. The venous plexus lies in the submucosa, supported by elastic fiber structures. Frequent increased pressure, such as straining during defecation, accompanied by continuous blood congestion, leads to dilatation and formation of hemorrhoidal clusters inside the anal canal. As one ages, the supportive connective tissue structures weaken, causing hemorrhoidal clusters to protrude out of the anal canal, leading to internal hemorrhoids. Classification of hemorrhoids. Hemorrhoids mainly come in two types: internal hemorrhoids and external hemorrhoids. External hemorrhoids, when hemorrhoidal clusters originate below the dentate line, also known as the anorectal junction. They are called external hemorrhoids. At this point, hemorrhoids are covered by squamous epithelium and lie beneath the skin surrounding the anus. Internal hemorrhoids, if hemorrhoidal clusters originate above the dentate line, they are called internal hemorrhoids, and they are covered by mucosa and transitional epithelium. Classification of hemorrhoids, based on the progression of hemorrhoidal clusters remaining inside or protruding out of the anus. Grade 1 hemorrhoids, hemorrhoidal clusters, are entirely within the anal canal. Grade 2 hemorrhoids, under normal conditions, hemorrhoids remain within the anal canal, but during straining, they may protrude slightly. After defecation, they retract on their own. Grade 3 hemorrhoids, with each bowel movement or straining, sitting for a long time, or heavy lifting, hemorrhoids may protrude. Resting for a while is needed for the hemorrhoids to retract, or gentle manual reduction may be required. Grade 4 hemorrhoids, hemorrhoidal clusters, are almost always outside the anal canal. Risk factors for hemorrhoids. Constipation or diarrhea increases the frequency of hemorrhoids. Straining increases pressure on the veins, causing congestion and blood stasis. Low-fiber diet increases the frequency of hemorrhoids. Overweight and obesity increase the frequency of hemorrhoids. Increased abdominal pressure encountered in individuals with heavy labor occupations such as carrying loads, weightlifting athletes, tennis players, etc. Prolonged standing, prolonged sitting, such as secretaries, tailors, salespersons, increases the abdominal pressure, hindering venous return to the heart, leading to hemorrhoidal venous congestion. Pelvic tumors, including rectal tumors, tumors in the uterus, and multiple pregnancies hinder blood flow back to the heart, causing venous congestion. Causes of hemorrhoids. The veins around the anus tend to stretch under pressure and may swell or become engorged. Hemorrhoids may develop due to increased pressure in the lower rectum caused by straining during bowel movements, prolonged sitting on the toilet, chronic diarrhea or constipation, obesity, pregnancy, anal intercourse, low-fiber diet. Hemorrhoids increase with age as the supporting tissue structures of the veins and the rectum and anus become lax and weakens over time. Symptoms of hemorrhoids. The signs and symptoms of hemorrhoids may include bleeding without pain during bowel movements. Initially, there may be a small amount of bright red blood on toilet paper or in the toilet bowl. Bleeding is the earliest and most common symptom. After straining, bleeding may become drops or streaks. Severe bleeding may occur when sitting for long periods. Itching or irritation in the anal area due to mucus discharge from the anal mucosa. Pain or discomfort, ranging from no pain, mild discomfort to severe pain due to anal fissures, strangulation, or thrombosis. Swelling around the anus. A lump near the anus, sore or painful. Hemorrhoid symptoms usually depend on the location. External hemorrhoids are the most uncomfortable, because the skin around the hemorrhoid is irritated and may ulcerate. If a blood clot forms inside an external hemorrhoid, sudden and severe pain may occur. Patients may feel or see a lump around the anus. The blood clot may be absorbed, leaving wrinkled skin, causing itching and irritation. Internal hemorrhoids usually do not cause pain, even when they bleed. Patients may, for example, see fresh blood on toilet paper or in the toilet bowl. Hemorrhoids are usually not visible or palpable, and they rarely cause discomfort. During straining, passing stool across the anus may scratch the surface of the hemorrhoid and cause bleeding. Internal hemorrhoids may also prolapse out of the anus, causing internal prolapsed hemorrhoids. When hemorrhoids prolapse, they may absorb a small amount of mucus and stool, which can cause irritation, itching, and pain. Continuously wiping to try to relieve itching can worsen the problem. Complications of hemorrhoids. Complications of hemorrhoids are rare but can still occur, including anemia due to chronic blood loss through hemorrhoids. At this point, the body does not have enough red blood cells necessary to exchange oxygen for cells. This situation is rare. Strangulated hemorrhoids. If the hemorrhoids prolapse and become trapped, causing the blood supply to the hemorrhoids to be blocked. At this point, the pain symptoms will be very obvious. When gently pressed, a lump may feel tender due to the blood clot. Venous thrombosis is the condition of forming a blood clot inside the blood vessels of the hemorrhoids. When the blood vessels dilate and swell, and blood stasis due to straining, heavy lifting, pregnancy, strenuous exercise causing increased abdominal pressure, creates favorable conditions for the formation of blood clots, causing venous thrombosis. External hemorrhoidal vein thrombosis will see a small swelling on the edge of the anus, accompanied by pain when touched, tension. Thrombosis in internal hemorrhoids will have a sense of pain and fullness deep inside, and symptoms are not as obvious as external hemorrhoids. Perianal dermatitis, pruritus ani, and intertrigo when the skin between hemorrhoids ulcerates, causing itching, burning. Treatment of hemorrhoids. Applicable to cases of symptomatic hemorrhoids. 1. Medical treatment. Conservative treatment and lifestyle. Eating a high-fiber diet is an effective treatment for bleeding, hemorrhoids, limiting irritants such as alcohol, chili. Avoiding strenuous activities, sitting for long periods, or standing for too long. Changing bowel habits to avoid constipation. Sitz baths in warm water help improve symptoms. Medication. Topical or suppository medications. Venous circulation support drugs. 2. Surgical treatment. For cases of hemorrhoids with thrombotic complications, hemorrhoids with blood clots should be intervened early by performing excision using classic methods or combining thrombus removal with other methods. Rubber band ligation or injection sclerotherapy involves injecting a substance into the hemorrhoidal vessels to shrink the hemorrhoids, usually applied to mild hemorrhoids. Injection sclerotherapy is indicated for grade 1 and 2 hemorrhoids that bleed frequently. The sclerosing agent causes inflammation in the hemorrhoids, which then shrinks. Ligation is used for grade 2 hemorrhoids and can be used for grade 3 hemorrhoids. The method involves tying a small rubber band around the hemorrhoid to stop blood flow to the hemorrhoidal clusters. The hemorrhoid then gradually shrinks and falls off within a few days. For grade 3 and 4 hemorrhoids, hemorrhoidectomy, a surgical procedure that involves removing hemorrhoidal tissue. Indications for hemorrhoidectomy include recurrent bleeding, pain, prolapse, and unresponsive, conservative treatments. In conclusion, hemorrhoids are a common condition that affects millions of people worldwide. Understanding the causes, symptoms, and treatment options is crucial for effectively managing this condition and improving quality of life. While hemorrhoids can be uncomfortable and sometimes painful, they are generally not life-threatening and can often be treated with conservative measures or minimally invasive procedures. However, it's essential to seek medical attention if symptoms persist or worsen to rule out more serious conditions and receive appropriate treatment. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.